So today, we're going to dive into a real-world mystery that actually unfolded during a global crisis. It's a story about doctors, about money, and about the incredibly tough choices they have to make. Choices that are shaped by these powerful and often totally invisible financial incentives. Let's jump right in. So let's just start with a simple but really profound question. Imagine you're a doctor, right? And all of a sudden, the financial ground beneath your hospital and your own paycheck starts to crumble. What do you do? How does that kind of pressure change the actual care you give to your patients? All right, so picture this. It's rural China. The year is 2020. The COVID-19 pandemic is just starting. And even in places with zero reported cases, visits to local hospitals just plummeted. We're talking by over 18%. People were just scared to go get care. And this drop created this massive financial shock for these hospitals, which, directly threatened the doctor's pay because it's often tied to the hospital's revenue. This really set the stage for a huge dilemma. Okay, so to figure out what happened next, we basically have to become detectives here. We've got to follow the money, and it turns out there are two crucial clues that pretty much unlock this entire puzzle. Okay, clue number one. In these hospitals, you had two different kinds of patients. On one side, you have your insured patients. Their care was paid for out of a fixed yearly budget. Now, this created a really fascinating incentive. If the hospital spent less than that budget, it got to keep the extra cash as a bonus. Then, on the other side, you have self-paying patients. For them, it was simple, a classic fee-for-service deal. The more services they got, the more money the hospital made directly. So you have two patient types with two totally different financial playbooks for the doctor.
So that system for the insured folks, it's got a name, the Capitated Global Budget, or CGB. The easiest way to think about it is like a yearly allowance for patient care. And the key thing to remember here is that with this system, every single dollar that's not spent on an insured patient is a potential dollar earned for the hospital and for its doctors through that end-of-year bonus.
Now for our second clue, and trust me, this one is a real game changer, the drug markup loophole. So after a big reform, Chinese hospitals couldn't just add a markup to most drugs anymore. They had to sell them at cost. But there was this one critical exception, a category of traditional Chinese medicine called decoction pieces. On these, and only these, hospitals were allowed to tack on a markup of up to 25%, which turned them into a direct pipeline for profit. Okay, so let's recap. We've got our two big clues, a system that pays bonuses for saving money on one group of patients, and a single type of drug that actually generates profit. Now let's look at the actual data and see what the doctors did when the pressure was on. The first piece of evidence that came out is, well, it's pretty striking. For those insured patients, the ones on that fixed budget, the average insurance payment for each visit dropped by 4.5%. Doctors were actively spending less money on them. And how'd they do that? Simple. They provided fewer services and prescribed fewer drugs. But here's the twist. At the very same time, something else was going on. The odds that a doctor would prescribe those profitable TCM drugs, the ones with the 25% markup, they shot up by 1.5 times. That's a huge jump. And this wasn't just for one group. It happened for both the insured patients and the self-paying patients. And this is where the whole puzzle gets really interesting. Just look at this table. For the insured patients, spending goes down, services go down. But for the self-paying patients, no real change. So doctors are cutting back on one group of people while pushing the only profitable product they have to everyone. So what on earth is going on here? All right, I think we have everything we need. We've got the clues, we've got the evidence. Let's solve this thing. So the key that unlocks all of this comes down to a really important idea from Health Economix called physician agency. It's this simple but super powerful idea that a doctor, as the expert in the room, is in a unique spot. They can be a perfect agent acting only for their patient's health, or they can use that expert position to nudge decisions in a way that benefits them. Yeah, think of it like this. On one hand, the doctor's entire job is to give you the absolute best care, period. But on the other hand, that same doctor is also an employee whose paycheck depends on the hospital being financially healthy. The pandemic just threw these two jobs into a head-on collision. So what did the doctors do? Well, faced with this pressure, they came up with this really smart two-pronged strategy. First, for their insured patients, they played defense. They cut back services to save money from that fixed budget, all to try and get a bigger bonus at the end of the year. But they also had to play offense. To make up for all that lost revenue, they started prescribing the one and only thing that could make a new profit, those TCM drugs, to pretty much anyone who walked through the door. It was a perfectly rational response to the incentives they were facing. Okay, so it's easy to look at this and think, that's an interesting story about rural China, but this goes so much bigger. This is a perfect case study with huge implications for healthcare systems all over the world. Because really, what this story does is pull back the curtain on a universal truth. These same forces are at play absolutely everywhere. It doesn't matter if it's a fee-for-service system in the United States that might incentivize more procedures, or a state-funded system like the NHS in the UK that's trying to manage a tight budget. The financial rules of the game are quietly shaping the medical care that every single one of us gets. And the researchers who uncovered all this put it perfectly. They said that because doctors are so central to everything, you have to think about physician agency when you're designing policy. In other words, you just can't ignore the human element. You have to consider how doctors, the actual people at the heart of the system, are going to react to the financial rules you create. If you don't, your policy is almost guaranteed to fail or have some crazy unintended consequences. And so all of this leaves us with the million-dollar question. Well, probably more like a trillion-dollar question that every country on Earth is wrestling with. How do you actually build a system where the smartest financial decision for a doctor is also the absolute best health decision for their patient? Finding that perfect sweet spot, that perfect alignment, that is the central challenge of all modern healthcare.